Hello, my name is Nicole Harling for the Parent Advocacy Program. Today we're going to discuss Tourette syndrome. And when we come back, we're going to introduce our guest for today's program. So come right back. It'll be a great conversation.
Okay, kids, here we are at the slavery exhibit. Now, as you can see, the slaves were kidnapped from their homes, chained together for weeks. They would cram them onto these ships in very appalling conditions.
Thousands of women and children are being smuggled across the border.
Sexual trafficking of children. As you can see right here, they were treated like animals. They worked all day long for no pay.
In sweatshops raided by police, children forced into slave labor.
Some of the slave masters were very cruel. They whipped them and they beat them, as you can see in some of these pictures.
Assault, brutal, even fatal.
So, before moving on, are there any questions?
Does this still happen today?
Welcome back to the Parent Advocacy Program. Again, today our discussion is around Tourette syndrome. What I want to do is introduce our guests around the table, and we'll start with you.
I'm Dr. Nathan Diegelman. I'm a psychologist with the Tourette Syndrome Counseling Program, which is run in conjunction with the Tourette Syndrome Association, and I also work out of Children's Hospital.
Great.
I'm Marge Henning. I'm the chairman of the Greater New York chapter of the Tourette Syndrome Association. I have 2 adult children with Tourette and several family members also.
Thank you.
My name is Sue Connors, and I'm president of the Tourette Syndrome Association of Greater New York State, and I have Tourette syndrome myself.
Thank you. Thank you all for coming today. I think it's very imperative we talk about this condition, because I think there's a lot of misunderstanding around it. And let me start with you, Dr. Diegelman.
Sure.
What is Tourette's?
Well, one of the hallmark symptoms of Tourette's that I think most people are familiar with, and what probably gets the most coverage in the media, are motor and vocal tics. What these are is these are movements or sounds that a person may make and has a hard time controlling or can't help. So some of the most common motor tics are eye blinks, head shakes, and things like that. Vocal tics are also something that has to go along with it, and these are sounds. And then it can also be breathing, sniffing, snorting, grunting. One question that we get a lot is, people with Tourette's, don't they swear all the time? Mm-hmm. And while swearing is a tic that sometimes goes along with Tourette's, most of the time it's not, or for most cases most people don't have it.
That's probably one of the most that the media probably emphasize, swearing and cussing, but it really isn't it, as you mentioned. It's a lot of different degrees of it.
Right, and you don't have to have swearing to have Tourette's.
Absolutely.
The other things that are signs of it is you'll see waxing and waning of the tics. So this is where things will kind of become more severe and then less so over time. And also you'll have different tics replace each other, so you don't necessarily have the same tics all at the same time. But then there's also a number of other conditions that go along with it, which I think are important to focus on as well. And that's a lot of what our interventions can help with.
Now, some of the conditions, what are they that goes along with it?
There's a number that are fairly typical. And we usually don't see a case of Tourette's where there's just tics. A lot of times there's one of these other conditions as well. Obsessive compulsive disorder, attention deficit hyperactivity disorder, or ADHD. We also see a lot of learning disabilities as well, and that's also something that my colleagues here have a lot of experience dealing with.
Now, one of the things I want to emphasize to the audience is that if your child has ADHD, it doesn't mean that they have Tourette's. Is that correct? Right. Conversely, though, if your child possibly have Tourette's, they may probably have one of these symptoms. How do you diagnose it?
Well, the diagnosis of Tourette's is made mostly through an observation and an interview. We don't have any, clear medical tests. There are no blood tests or any other tests like that we do. So most of it's made through an interview. It can be made by a primary doctor, a psychologist such as myself, a neurologist as well, as a specialist who is oftentimes trained to identify these sorts of things.
Now, Marge, Tourette's is also hereditary, is that correct?
Yes.
And you have 2 sons with Tourette's.
I have 2 sons with Tourette's. Our youngest son was diagnosed when he was 8, and our older son was not diagnosed until he was 13. And that's a part of the difficulty with Tourette also, that no two cases of Tourette are exactly the same. And after they were diagnosed, then we started diagnosing more family members, and my brothers and sisters, nieces and nephews, aunts and uncles.
How did you say they were diagnosed? What tipped you off, if you will?
Our son was having what he called a smiley tick. Well, it wasn't a smiley tick. He just called it, he was smiling, and he smiled at everybody when he was afraid and nervous and upset. And he started getting yelled at in school for smiling when the teacher was yelling at somebody else. He had a lot of OCD issues, things he was doing over and over again that he wasn't supposed to do. And he was making a noise. And luckily, I took him to the pediatrician because we thought it was allergies bothering his throat. And the pediatrician suggested it could be Tourette. And when I mentioned it to the school, they directed me to the school nurse, and she luckily gave me a whole packet of information on Tourette and had me take it home and read it. And I went through a long weekend of denial, picking out the parts of Tourette that he didn't have, making sure that he could not have Tourette. And then luckily I was hooked up with Sue, who actually taught in the district that our son went to school in, and because she had started the Tourette chapter here, he was in very good hands, and things were taken care of very well for him.
Now, Sue, talk about the chapter, because you've been around for 25 years as of this year.
Yep, it's our 25th anniversary this year. I started it shortly after I was myself diagnosed with Tourette. I started with my first symptoms when I was about 6.5, and I actually was not diagnosed until I was 36. And it's not that I didn't try. I was taken to many doctors by my mom over the years and continued on even into my 20s going to doctors myself trying to get an answer. And I got a lot of strange diagnoses, but never the correct one. And I actually found out about having Tourette from a television program that I watched. Somebody may remember the Quincy program that used to be on TV.
Yep.
And he did a show about Tourette, and that's how I figured it out. And not too long after I was diagnosed, we suddenly realized that it was very prevalent in my family. My 5 sisters and brothers all have Tourette.
Okay.
My mom had Tourette. We have about 24 family members now with the disorder. So it's very, very prevalent in my family. And I started a chapter in the Western New York area with 7 families. And now we cover the whole state of New York practically, and we have almost 700 families. So we've grown to a formidable size.
Wow.
Yeah.
So all you guys, you have Tourette's.
Yes.
You do also.
Yes.
And you have children with Tourette's. Your children are living very successful lives.
Yes,
Is that correct?
yes. They've both graduated from college, although it took them a little extra time to get out of school, but they did manage. You just have to keep your eye on the goal and not get discouraged. And they needed some assistance through school, but they're doing well. They're living on their own and paying their bills.
Well,
Very good.
that has nothing to do with Tourette's, but they are functioning as a working society. That's wonderful. And one thing I want to talk about when we come back is when Tourette's is diagnosed in the school age, elementary, middle school, what are some of the things that parents can do to help their children with that? Because I think there's a lot of misconception, a lot of fear, a lot of anxiety, and from talking with you guys earlier, it seems as if the key is to be supportive of your child and realize that this condition is treatable, that there is no cure, but it's treatable, it's not a disease, and you can absolutely live successful lives doing that. So we'll come back and talk about that in a minute. So come right back. Thanks.
Different words describe different people. But in the eyes of the law, there's one that fits us all. Human right number 7. We're all equal before the law. What are human rights? Find out at youthforhumanrights.org.
Welcome back. Again, my name is Nicole Harling with the Parent Advocacy Program. We're discussing Tourette syndrome, and I want to start off with you, Dr. Diegelman. What is the age that most children are diagnosed with Tourette's?
The average age tends to be about 7 years old, but there's usually a range. we have some kids as young as 3, although that's very unusual. Usually kind of, 5 to 7, 7 to 9 or 10 or so is the age when you frequently start to see symptoms and then make a diagnosis.
And reiterate some of those symptoms parents may want to look for?
Oftentimes there'll be motor or vocal tics. These will be kind of movements a child may make, or even sounds, words, other noises that they may make as well that they can't help and that are hard to suppress.
What is the treatment for Tourette's, if you will?
There's actually a number of treatments, if you will. There's no cure.
Right.
And a lot of what we tend to focus on, especially with the Tourette Syndrome Association, is management and also coping. There are some medications that exist to treat tics, as well as some of the OCD and ADHD symptoms, but especially in younger kids, we often try to see what kind of effects we can have with kind of parent support, also counseling and different psychological interventions. One intervention that's oftentimes really important to have is to be able to do some work with the school. A lot of times kids with Tourette's, as we mentioned before, will have any one of a number of associated conditions such as ADHD or learning disabilities or obsessive-compulsive symptoms, and intervening early in the school can be really important for them.
Is that what you did, Marge?
Yes, I did. As an occupational therapist, I worked in the school, and I did happen to work with an excellent therapist, and we had a student diagnosed with Tourette, not my own son, but a boy in the school I was working with, and she developed a wonderful program, and I learned a lot how to work with kids with Tourette from working with her and working with this young man. And I have really tried to get more of that into the schools and teaching people about what occupational therapy can do in working with kids with Tourette. Our son didn't need those services. He did need education, and Sue went into the school and did an education program for his peers. The teachers already knew about Tourette just because she'd already been there before that. And then as he got older into middle school and high school, he did need special ed services just to accommodate his attention deficit, his disorganization, his OCD. So making those accommodations for him were important in getting him through the school.
Now, you mentioned the school, because that seems to be key. I mean, you mentioned average age of 7. Kids are diagnosed. And then they have all the other things happening with school. What are some of your suggestions to parents that, again, have children that are diagnosed with Tourette's, that are, just starting? What are some of the positive things they can do to help their children cope with this condition?
Well, I think that the most important thing is to inform the school, and there are some parents that are sometimes reluctant that their child will get a label or whatever, and they don't want to do this, but I think it is critically important because Tourette is one of those the disorders, and I speak from personal experience when I say this, that is often misinterpreted as a behavior problem. Kids making noises when they're not supposed to be making noises, saying inappropriate words, disrupting the class inappropriately, and it's something not within their control. So doing a good education program for the teachers. But I think the social emotional aspect of Tourette is just as difficult, and that is other kids not understanding it. I often say, if you put a child in a class with a hearing aid, they assume the child has a hearing problem because everybody recognizes that.
Absolutely.
But if you got a child, ticking and saying inappropriate things, I actually taught a student who had a tic where he yelled out, "I had a chicken in my pants." That was his tic. But that's not such a bad tic after all.
A little uncomfortable.
A little uncomfortable.
Not a bad tic.
If people hadn't known, imagine the reaction he would have gotten from the other kids as far as teasing, making fun, and imagine the punishment he would have gotten from teachers. So, education is the key.
Yeah, because it seems as if, the parents come in and they want to get their child fixed, but there is no fix.
Right.
And then you have to start with them first, almost as if to say, kid is fine, but we got to kind of focus on you because they may want to kind of suppress it, and you really can't.
No.
Yeah, sometimes I think it's hardest actually for parents, even more so than some of the kids. Because here you see your child is struggling and doing these things that you may not understand why or what's going on, and that can be really tough.
Well, I think you guys are excellent examples. I mean, you're a doctor, you're a teacher,
Right.
and you have Tourette's, and you're living very successful lives. I mean, that must qualms, some of their fears. And you're also successful with your children. So when the parents hear that and they see that, they're like, okay,
Right.
it must absolutely help.
Oh, it does. We hear that all the time. That
Good.
they're, oh my gosh, when I'm talking to a new parent and partway through the conversation I'll say, by the way, I have Tourette. And they're overwhelmed because some parents have said to me, this is the first hope I've had since I got the diagnosis. And I can't tell you how many parents have gone to see Dr. Diegelman, and then I'll see the child in a school setting, and he'll say, do you know that Dr. Nate has Tourette? And that is the most exciting part of their first visit to you. Because it's like...
Get anything that you said.
Exactly. It just gives them the hope that, you can live through this. And it's tough. It's going to be a hard road. You're going to have a lot of inner strength to get through it a lot of times.
A lot of support groups you guys have.
A lot of support in school, a lot of support groups and whatever, but you can make it. People have, and I think that's so important for not only kids but families.
I found that...
I'm going to get back with you on that. We're going to come right back on the next break. We're going to come back, pick up with you, and I also want to discuss support groups, what's happening on ABC.
Yes.
And Good Morning...
AM Buffalo.
AM Buffalo.
Yeah.
And we'll discuss that when we come back. So come right back. We'll discuss it some more.
Can you tell which of these children was not born free? Can you tell which of these children was not born equal? Can you tell which of these children does not deserve to be treated with dignity? We can't either. Human right number 1. We are all born free and equal. What are human rights? Find out at youthforhumanrights.org.
Welcome back. This is Nicole Harling with the Parent Advocacy Program. Today we're discussing Tourette syndrome, and we left off with Marge. You were going to mention about the support groups.
I was. I feel that one of the most important things for me was my involvement in the support group because, Nate, you probably don't even remember this, but you were in high school when we got involved. When David was in 3rd grade. And seeing you in high school, actually, seeing how you were surviving, you were maybe middle school, high school, you were right around there. But seeing how he and a couple of the older kids were handling the situation and getting on with their life, it really gave me hope. And of course, that's one of the worst times in the life of a Tourette child is middle school and high school. But just seeing some of the older kids was a big help, and also going to the national conferences gave me a huge amount of information and hope, and many of the people at the conference with some rather severe symptoms of Tourette who are very successful businessmen and wonderful people besides, and that really is an important piece that you keep in mind. And many of the parents in the support group, we all have our ups and downs, the waxing and waning of the symptoms. But there's always somebody there to support you and know what you're going through or you're going to go through.
Absolutely.
And one parent has said, I hear you guys joking about this. Is it okay to joke about this? And it is the only way to get through. You got to have a sense of humor.
Laughter is Sue, tell me about some of the programs you do with the children.
We have a lot of children's programs. We run every 2 or 3 months. We try to have some sort of a social activity, a bowling party, a skating party, something like that. We do an annual overnight recreation program at Hickory Hills Camp in Bath, New York. It's a 3-day weekend where we bring kids together in a camping experience, and it's just phenomenal. And they absolutely love it, and it's a chance to meet kids from all over the state that have Tourette. Last year we had 39 kids who attended.
Great.
So a great group. We do fundraisers. We're doing a Chevetta's chicken dinner coming up in September, which is great. And we get the kids dressed up in their chicken outfits, and they go out on the streets, and we call them the Chicken Chickens. And They really bring in the crowds.
I'm sure they
bring
do.
in the crowds.
I'm sure they do. It definitely breaks down barriers.
Exactly,
Good, that's
exactly.
good.
Sometimes we bring guest speakers in for our support group. We just have a lot of things, and we try very much to involve the kids. in
Now, you
getting
guys
to
are
know
going to
each
be
other.
on ABC, right?
Yes, we were very much a part of a special that's been taped actually almost a year ago now for Prime Time, which is going to air Tuesday, July 15th at 10 p.m. on Prime Time. And it was all the four they're featuring four girls, and all of them are, except for one, are from the Western New York area,
Okay.
one from Buffalo. And it's going to air, as I said, on July 15th, and we're very excited. A lot of it was taped at Hickory Hills Camp when we had our program there last year. So, and the young girl from Buffalo and myself and the girl's mom are going to be on AM Buffalo and PM Buffalo this week.
Oh, good.
Yes, to promote the program. So
Wonderful.
yeah, we're
wonderful.
very excited. I think they've done a very nice job.
That's great. That's
Yeah.
great. I mean, get national exposure. And I really think it's important that the audience realize that, it's a lot of stereotypes with Tourette's, but it really isn't what you think it is.
Exactly.
And then once you get beyond the diagnosis of it, then it's a matter of coping with it
Yeah.
and dealing with the disease. Tell me about some of these success stories, if you will, with Tourette's.
I would,
Well,
I
here's
would
one
say
right here.
have a lot of
Right
them
here.
Dr. Nate is
Exactly. This
Dr. Nate is
definitely
our
one.
big success story.
Exactly.
Dr. Nate has Tourette's as a
Yes,
success
exactly.
story. There you go.
I think there are a lot of them, and I think the key with a lot of people who've been able to kind of cope successfully is that we've had a lot of good supports, and a lot of what we have to offer now. And I'm doing a lot through the counseling program, which I love to do, and also having the ability to go into schools and to do a lot of the work we do in schools, not only just for teachers but also for the kids as well. Those parent services make a huge difference.
What do you need to be even more successful? What do you guys need to even, be reaching out there to the community even more so?
We need funding really to. We've applied and received grants. That's how we started our counseling
Great.
program to be able to continue. I mean, right now we started as the Western New York chapter. Now we cover most of New York State.
Great.
So Marge and I, in particular, spend a lot of time traveling to schools because we do a lot of the peer-in services and the teacher training programs, and it's costly. Not that we charge for it. There's
Right.
no charge for it, but we have to get there and stay there and eat and all those
And
kinds
do
of
all
things.
those
So
things.
it really, but it's an invaluable program and it's a service that the chapter has offered for years, bringing the resources to the schools and educating everybody. And you can take a child who has been, punished, the brunt of everyone's teasing, and just living a pretty miserable life and failing in school, and with a one-day education program for teachers and students, you can turn that kid's life around. I've seen it happen.
That's so important too, because you mentioned, working with the children that get diagnosed with Tourette's, and the parents,
Right.
but also the students who don't have Tourette's need to understand.
Yes,
You
yes, they do.
And you guys do a lot of that.
Oh, tons of
With
it.
them.
I'm doing one
Yeah.
tomorrow.
Good, good,
Yeah.
good.
I'm in schools. We're both in schools all
Yes.
the time doing
Do
it.
you get aha moments when you're done, or when you're talking to the students, and they're like, "Oh, okay." Do you see that a lot?
Every time.
Every time.
Every
Yes.
time. I
Yeah.
don't think I've done one when I haven't seen that. It's just,
Good.
okay, now I get it. The little boy I'm working with right now has a tick where he goes, ha 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 ha, and it sounds like he's deliberately laughing and disrupting the class. It's a tick.
It's a tech.
And once the teachers, it was, got it. We were punishing him. We thought he was just being purposely
Yeah.
disruptive. And it's just a tick that he can't control. So.
And you know what? And it's one of the things too I want to kind of focus on is that sometimes students, I think you mentioned, try to suppress their tics
Yes.
during school or during an activity.
Yeah.
Then they go home and relax, and it's even more so there.
Yeah.
And so that's almost like the reverse.
Yeah.
Tell me the story of the child you mentioned that was perfect student, but he really
Right. He was coming across to teachers as the perfect student. He had a lot of OCD, obsessive compulsive disorder with perfectionism, but he would go home and totally melt down for sometimes 2 to 3 hours at night, where he would just be tearing his room apart, throwing things around, and I mean just in a total meltdown. And teachers would never have believed that, but we encouraged, and the parents were not quite sure they wanted to do this, for them to bring a videotape they had done of one of his 2.5-hour meltdowns and show it to the teachers. And it was I mean, we had teachers in that room crying as they were watching this. It was just an amazing thing because it was not the kid they saw in school, but he was trying so hard to be perfect and suppress, and you can only do that for a certain amount of
Absolutely.
time. It's got to come out.
And it came out when he went home with his
it was
family,
horrible.
more relaxed.
And
And
so they realized that they needed to give him some supports in school, you know, reducing the amount of homework, helping him with some of the frustrating issues in school, so that he wouldn't come home in that state every night.
Absolutely.
So
That's good. Yeah, that's good to know. So it's something whereas it's just, I'm going back to it, education. Just knowing what it is. Now I know one of your wishes we discussed is have a occupational therapist in each
Yes, I think
school.
if every student with Tourette could have an occupational therapist in their life as a coach and mentor, and be able to explain the whole package to the school and the peers, and create programs that would help that child, and educate the child to advocate for himself or herself. Occupational therapy is an invaluable tool that needs to be utilized
So even
more.
when your son was diagnosed, you were doing occupational therapy.
Yes, I was. Yes, yes.
And so then, ironically, how that worked out.
Yes, and I was, my major focus was school-based therapy, but I have learned a lot more about it, you know, since he's gotten out of school, and I continue to learn. The thing about Tourette is too, and I mean, here we've lived with it all these years, and I've been working, you know, for the chapter and doing seminars, and I continue to learn more all the time about Tourette, so that you never stop learning. And sometimes it's scary when we go into a school and a teacher will say, "I had a student with Tourette. I know everything there is to know."
Oh.
Because
heard that one many times.
I don't think we know everything.
Exactly.
So,
because I keep learning, so
Exactly.
yeah.
Well, you know what? I think this conversation has been very informative, very educational. The key is education, and the key is to realize that, as that movie on HBO, I have Tourette's, but Tourette's doesn't have me, which is a very good movie.
Yes.
They really need to show that again, because it taught me a lot, you know,
That's great.
not
Yes.
knowing, but I was
Yeah.
like,
Great
oh, okay, you
Yeah,
know, and it wasn't
yeah.
the extreme
Right.
I've seen. So I want to thank you all for coming today, and hopefully you'll come back again and we'll discuss some more. Maybe bring some children here.
Sure.
We'd love to do that.
Yeah,
That's fantastic.
that would be
I
great.
think so. I think
Kids
that's
are
good.
hams. They would be happy to do it.
Thank you again for joining the Parent Advocacy Program. Join us again next time. Thank you. You guys are great. It's a very good conversation.
Thank you.